Welcome to LECOM Health Matters today. Our guest today is our favorite Dean of Pharmacy, Dr. Rachel Ogden. Rachel, welcome to LECOM Health Matters. It's a joy to see you, and thank you for being with us.
Thank you very much for having me.
Oh, it's our pleasure, Rachel. You know, years ago, I am on the fourth floor with you in our pharmacy building, and when I walk around here and I see some of the old ways that pharmacists dispense things, some of the tools are there when they compounded drugs. And basically 30, 40 years ago, as I understand, you went to the pharmacist, he filled a couple things, and that's it. But clearly, over the last 10 or 20 years, therapeutic medicines have taken over the business of healthcare. There is so much medicine available. And hasn't that driven a role change for the pharmacist? It's not just the person that you go with that script from the doctor and get your prescription filled, and he or she takes a couple pills off the shelf. There's such a vast variety of medications available, and so difficult for people to really understand what those are, that I think the role of the pharmacist now is far different now than it was 20, 30 years ago.
For sure. And well, 20, 30 years ago, I mean, so that actually my career has been 35 years. So, there's been big changes since then. But even, if you think historically, when you think of the pharmacist, and that RX symbol actually stands for recipe. So, or it meant a recipe. So the physician knew what ingredients, active ingredients he wanted the patient to have and what the dose was. The pharmacist kind of mixed it up, as you said, like compounded it and dispensed it to the patient. And pharmacists, even from the historical perspective, were always focusing on safety, making sure that the medication was safe and making sure it was efficacious, that it did what, it was supposed to do. That's always been the focus, still is the focus. But you're right. There's so many layers to the comment that you made as far as advances in medicine. Um, Now it's not just a matter of, is it the right medicine at the right dose, taken the right way, but all of the behavioral aspects that go into, health and making sure we're taking our medicines at the right time and that there's no interactions and that we incorporate the lifestyle changes needed. And patients are living so much longer, they have more chronic diseases. So they're taking more medications for longer. So it's that those behavioral changes that I talk about are very, very important. And the person that you're seeing every month when you get your medication filled is the pharmacist. So the pharmacist is becoming more and more involved in other aspects of treating patients. Not just the dispensing of the medications, but the monitoring of the medications and making sure the patient's progressing towards goals. Not to mention the other types of activities, the services and clinical services you can get within a pharmacy. But oh yes, there's you know many changes that have occurred over time in
Well, it seems to be, and is it further complicated, Rachel? Sometimes it's so hard to get in to see a physician. And so when that patient goes to get their prescription filled, I suspect there's far more interaction between me getting my prescription filled in the pharmacist than there was even 5 years ago about potential side effects or how I'm feeling.
it's funny because I think nowadays we gauge everything pre-pandemic, post-pandemic, if we can even say post-pandemic. But with all of the testing and the immunizing that's going on inside the community pharmacy, yes, we have always, branded ourselves as the most accessible healthcare provider. You can go in and talk to a pharmacist. You don't need an appointment. But I think we all know, if you've seen, the media with the signs that say, pharmacy pharmacy closed for, so this hour because the pharmacist not available. So there's been changes that have occurred during the pandemic, with staffing, with availability, of medications, which have changed things a bit. But yes, still, you see your pharmacist more often than you see your physician. They're accessible for questions, for counseling, for consultation. So, um, Yeah,
They're
we're,
busier now than they were years ago. Are they permitted to give vaccinations, or is that a state by state
I'm
rule?
sorry, Muncie, can you repeat that question?
I'm sorry, Rachel. Are they permitted to give vaccinations, pharmacists? Could they give flu and COVID vaccinations, or is that a state by state
You're right.
regulation?
There are certain regulations that are state to state as far as scope of practice for a pharmacist. But pharmacists can vaccinate in all states. Yeah, we're able to vaccinate.
And so, since their role obviously is vastly different, and I think that's a fair word to say it's vastly different than it was 10 or 20 years ago, relative to the counseling that they do with patients, the medicine explanation, the interaction possibilities with such a variety of medications. I suspect the education of them, which you're responsible for, is also changed.
Well, yes, it has changed in a sense that when I graduated, a number of years
10
ago,
years ago.
the um, the emphasis on clinical skills was not as great for someone who was coming out with, the Bachelor of Science in Pharmacy, and you were going to, go on to be a pharmacist. Now, pharmacists still obtained Doctor of Pharmacy degrees. They went on to residency, so they spent more time developing clinical skills. But now, with the Doctor of Pharmacy being the terminal degree, we, not only has things changed regarding, technology and the types of delivery systems of medications, but also the clinical skills that we use now as far as assessing certain things in patients, as you mentioned, giving immunizations. We do medication therapy management, point of care testing. So there's a lot of different things that are being done that are common that weren't common, 20 years ago, 30 years ago.
And how long does it take these days? I know we have two different pathways, and I think, or three different pathways. I think the audience would be interested. What is the actual training for the pharmacist that you oversee? How does it work?
So typically, a pharmacist, it takes a total of 6 years typically to become a pharmacist. You can complete the prerequisites for a pharmacy degree in 2 years, and then you can go on to a 4-year pharmacy program. So our distance education program and our Florida program are a traditional 4-year program. But in the Erie campus, we have an accelerated program. So you can complete the same number of credits as the 4-year degree. You can complete it in 3 years. So it's more of an all year round curriculum, and it can be completed in 3 years. Now, that being said, some students decide that they would like to obtain their bachelor's degree first and then go on to pharmacy school. So that would be a total of 7 or 8 years, but it really depends on the person. Most pharmacy schools, you can complete the prerequisites in 2 years.
And are our students mostly 2 years and then they come here, or are they mostly four, or is it split?
It does vary. We have students that that have 2 years of prerequisites. We have a large number of students who have bachelor's degrees, and we have some students who have advanced degrees and have decided that maybe they want a career change and decide to go into pharmacy.
Well, I think that's an important point to make, the career change people. We welcome the career change people. And obviously, you have to make sure they have their science background or enough science to get through it. But those kinds of interesting people who want to make that change are welcome here, are they not?
Absolutely. Yeah, we have a number of nurses, dietitians, social workers, people who've been in healthcare, and others who've not been in healthcare, engineers, others who really just have a yearning or desire that they want to be a pharmacist. So some are transitioning into healthcare, some are transitioning from another, healthcare profession into pharmacy.
And depending on the pathway, they're going to spend some time in a classroom and obviously a significant amount of time working either in hospitals or in chain pharmacies. But I want to talk a little bit about distance education and pharmacy because that's relatively new. How does that work?
Well, our distance education program has been up and running since 2014. So it's been a while. and we've had good success. There's different types of distance education. You can have independent study. Of course, there's a component of pharmacy education that's experiential or clinical. So, you can't really do that by distance. You have to be in a facility where you're with patients. We have a different kind of model where part of it is what you would call asynchronous, meaning you can do it on your own time, it's flexible. But then we do have a number of hours during the week, and especially during exam times and other sessions, which are more active learning, that the student has to be present at a particular time. So the combination of synchronous and asynchronous makes the student very engaged in the program. It creates a very close-knit distance education community with the students that are in that pathway. And we have seen a lot of success with those students. And it's wonderful because we have students participating from all over the country. They are in rotation sites all over the country. And it's wonderful because it's part of LECOM community, in that particular, other community where maybe we don't have a live campus, but there are, our students are right there and practicing, and so, it's put LECOM, out there in a lot of different places.
And being together, even over the internet, as you said, must build some sense of community
Oh,
among these students from all over the country.
absolutely. Absolutely. They participate in our student government. They're in our organizations. They do community service in their communities, just as our live, campus students do it in our communities. They're very engaged, and there are certain times when they do come to campus. They come to campus a few weeks in their first year, and I believe 1 week their second year. And at that time, it's to see them embrace and be so happy to see each other in person and interact with the faculty members. It's really wonderful. So
You're right. My office is right down the hall from our pharmacy lab, and it's delightful to see them
yeah,
when they come back in the summer, because all of a sudden our lab is filled with students that you don't know. Where did all these people come from? And then you find that they're from Seattle, they're from all over the world. But just to put a point on it so we don't miss it, even though it is distance education, and even though they come to campus for a few weeks during their tenure, they still do the clinical in-service in the various hospitals or pharmacies, correct?
for sure. Yes, and we work with them to. We've established sites in locations all over the country. So the goal is to keep them in their geographical area for their location, for their rotations. But yeah, they have to the distance education program meets all of the same requirements for accreditation as our live pathways. It's just that you have the flexibility to do it from your home as opposed to moving to campus.
Is there a profile to a distance education student? Do they tend to be older or tend to be career change people, or
So
just a variety?
in the beginning, to be honest, so 2014, 8 years ago, um, we saw, individuals with families who didn't want to move away from their family or didn't want to uproot their family, or maybe had different situations. Um, Now, just 8 years later, online learning is more prevalent than it's been in the past. We were the second pharmacy program to have a distance education pathway. That number has increased over the last 8 years, but because it's become more prevalent, um, students who find that learning environment works well for them may be more likely to apply, whereas in the past, it wasn't necessarily an option for them.
And if a student or someone listening to this is interested just in talking about pharmacy as a potential career, or talking about a career change, or just wanting to sit down and talk to a professional about coming to LECOM in one of the pathways or in the distance pathway, how would they go about doing
I would encourage everyone to visit our website at lecom.edu. And there's a variety of information. If you go to the academics section and look for pharmacy school, you'll get a lot of information there. But then there are also email addresses and phone numbers where you could call the school and get information. So, I welcome you to call the school and you'll get a person, a person answers the phone. So they will definitely direct you to the right person to talk to.
And we have to talk about this as well because it's part of the process, but we also indirectly assist them a little bit relative to finances, with put them in touch with financial aid people who walk
Sure.
them through that very complicated process of loans and cost and how to make this affordable and realistic for them. They're not on their own. We'll support them all the way through.
Well, absolutely. Well, I mean, as you know, that one of the tenets of LECOM is that finances should not be a barrier to anyone getting a professional education. So we're very conscious of our tuition and keeping our tuition affordable for our students. We also raise a lot of money in scholarships. But as far as financial aid, we do have a financial aid department. You go through the financial aid process in graduate school, very similar to undergraduate school.
Right.
So if there are any questions during the process, our financial aid department will help you. As you said, every step of the way.
And just like in undergraduate school, they're here to take them by the hand literally and walk them through what is, I think, a very daunting process when it comes to finances and financial aid. It's difficult. So people should not feel uncomfortable about calling and simply inquiring, and we'll take it from there to follow up on their interest. And is there a deadline per se, let's say for the coming year, that people should commit?
Well, we have rolling admission. So we start our admission cycle. It opens in July, but you could start your application. We usually start interviewing late August, early September, but we start interviewing and we accept applicants as we go. And so to make sure you have a seat, it would be wise to interview and apply early and then, make that commitment with your deposit. But, we usually are, the deadline for the year is June 1st.
And one other question, jobs. What's the job market like these days for the pharmacist? I know, like every other job market, I suspect it's changing, but what's it like?
Well, pretty good. So, even I was just actually looking online today for a pharmacist that was in the area, and there are a large number of jobs in the Erie community, hospital community, managed care, variety of different types of positions. It depends on location, and
Area.
sometimes in an area that has a pharmacy school, then the jobs aren't as prevalent maybe as in a rural area where there's not as much of a population. But I have to tell you, the community pharmacies are continuing to give sign-on bonuses to pharmacists. Pharmacists are needed and wanted, and the jobs are there. So we had high placement of our graduates, and I believe in the future with all of the services that are going to the community pharmacies, the need is going to be even greater.
Well, I think we should also make the point to the audience as well, Rachel, that community pharmacies are one portion of it. There are pharmacists in hospitals, nursing homes, long-term care facilities. It's not just, I think when people think pharmacists, they think Rite Aid, Walgreens, the chains or the clinical sites. But there are lots of other opportunities, correct?
In fact, I was just talking with a pharmacy candidate today, and she did some shadowing in a hospital. And so she was under the impression that she was in the hospital, she was just going to go to the hospital pharmacy and see what they do within the pharmacy. But they actually put her with every different practice area in the hospital. So she was in the pharmacy, but she was also, where they were compounding IV medications. She got to round with physicians on the floor with the clinical pharmacists. She was in the NICU with the pharmacist that works in that particular area. She was in an outpatient pharmacy. She got to see a pharmacist counsel patients before they were discharged to make sure they were knowledgeable about the medications on discharge. So, she was flabbergasted. She said, I didn't know just in a hospital how many different things I could do. So, I mean, that's one example. But, as I mentioned before, in their arena of managed care pharmacy, which is more of the insurance arena where they're evaluating medications and deciding, what medications patients should have on their formulary for insurances, or with even drug companies that are trying to educate physicians and others on new products. There are pharmacists all throughout those industries also that people don't really realize that.
No, I think they just think pharmacists, they think, the giant eagle and whatever, and they don't think of the other myriads of possibilities. Well, we're out of time, but number one, thank you for your time, Rachel. Secondly, pharmacists really are the medicine experts, I think, in this day and age, with so many out there, so many different possibilities to help patients. So it's an exciting field. I know the graduates that you produce are really very good and are employable. We thank you for your work. And today I thank you for your time on LECOM Health Matters. Have a happy new year, Rachel.
You as well. Thank you.